Welcome everyone to today's Moxy webinar presented by Dr. Laurel Wentz. Dr. Wentz is a professor at East Carolina University and is currently doing a research project with British military recruits in Wales. Today's topic is the pattern of Moxy monitor results versus metabolic output during high-intensity cycling intervals. Dr. Wentz came to us through Marianne Kelly of Dietitian of the Desert. Marianne is one of our charter certified training centers. She's now in the Chicago area, so a big thank you to Marianne for getting us connected with Dr. Wentz. Dr. Wentz is also part of our newly formed Moxy research group. For more information on that group, if you'd like to join, please contact Stuart, and his email address is stuart@moxymonitor.com, which is STUART@moxymonitor.com. So the format for today, we're going to have about half of the presentation in the first 20 minutes, then we'll stop for a short Q&A session kind of in the middle, then we'll finish up the presentation and we'll have a longer Q&A session at the end. So if you have any questions, please type them into the questions panel on the right side of your screen, and we'll take them during the Q&A periods. So with that, I'm going to turn it over to Dr. Wentz, and she can go ahead with the presentation.
All right, well, thank you all for joining us today. I'm going to turn off my camera, and that way give you full access to our PowerPoint. So, as Roger said, we're going to talk today about the pattern of the monitor results in a lab test, test we did in the laboratory. So I'm presenting from East Carolina University along with Justin Smith, who's a master's student who actually used this project as his thesis. A little bit of background, and this is how I was connected with Marianne. So my background is nutrition, and Justin is nutrition, and as you can see from our intro, we are from the Department of Nutrition Science at ECU. So how we got interested in Moxy? Well, I had worked for Special Forces Group at Fort Bragg prior to taking position at ECU, and Justin also interned at Fort Bragg with a different Special Forces unit. And there is a lot of cycling background, but then there's a lot of just overall training within these elite military units, and a lot of them have purchased Moxy monitors to see if they could use it as a tool. And they didn't really have a lot of research to go along with what they wanted. And I'm bringing that around to how we ended up actually doing cycling within this specific project. But to give you a little bit of background on military, they have a wide variety of performance requirements, and what I mean by that is, unlike your traditional triathlete, they need a lot of endurance, but they also need strength. And so that's where we thought, you know, maybe we could play around with this Moxy monitor and give them a different type of training that they could do with it. They also have a lot of interruptions in their training periodization. So unlike a lot of your more stereotypical athletes, they can't train at a specific time or specific periodization protocol because they may have to go on deployment or different training or TDY or other types of units. So our main research question was, how could the Moxy monitor integrate into tactical training? I will give you a little disclaimer, this presentation does not answer that question. What we have today is a pilot study, because when we brought this question to the clinical investigation team at Fort Bragg, they wanted to see more research on the Moxy monitor because they didn't have any. They didn't doubt the NIRS technology, but what they asked us is, why is this specific to military, and we want to see what it looks like in a more traditional laboratory setting. So what we started off with here is a pilot study. So this was our first pilot study. We just have a few subjects, and rather than compare the Moxy to other types of NIRS measurements that have been well validated, what we ended up doing was looking at, are we following the same pattern as other physiological measurements, meaning VO2, heart rate, lactic acid? If we use this in a specifically controlled laboratory setting, is it measuring what we think it's measuring? And within these intervals, can we use it as a training tool that would correlate well with these other measurements? And so we used that this past fall as Justin's thesis, and he actually did all of the recruitment and data collection, and I mean we had a lot of students involved with undergrad and graduate program as well, and collecting all the data. So we had a fun project and a really fun team to set this up, because it was a fairly involved study for just to collect these 6 subjects. So I'm actually going to let Justin take it over and tell you a little bit about the recruitment, the research protocol, what we did with these subjects, because we had them in the lab for a couple hours, and then just a little bit of background on who these subjects were and what their specific training was. So Justin, if you want to pick it up here.
Sure. All right, so I'm going to kind of run you through some of the methods that we did and kind of how we went about it. So first of all, we had 6 total subjects. We did obviously want them to be endurance trained, so we wanted to go for a while so we can see their SMO2 going up and down. We did have some parameters that we wanted them to have, and for us, endurance training was defined as more than 30 minutes of endurance type training at least 3 times a week for the past 6 months, because we wanted to make sure that they were indeed endurance, not weightlifters or something like that. The second point is that we did use a total of 3 Moxy monitors. We had them one on the left quad, one on the right quad, and we also put one on the deltoid to see where maybe oxygen was also being pulled from, similar to how like a glycogen test would be run. So the kind of equipment that we used, we did decide to do a cycle test. So it's a cycle ergometer, a stationary bike. The first thing that we did is a VO2 max test. And there's a couple things that we wanted to take from this. The main thing that we wanted to take was actually to get a maximum mileage, not necessarily really see the VO2. The VO2 was important to establish that they were in fact endurance trained. And for us, we decided to put that cutoff at 30, a VO2 max of 30 milliliters per kilogram per minute. And that was just to ensure that they were in fact endurance trained and could continue on for the rest of the testing. So the way that we did this, we also worked with some ECU exercise physiologists in this as well, and developing the protocol. So it's pretty standard. We started them at 50 watts, and every 60 seconds we increased it by 15 watts. So 50, the next minute 60, the next minute on 50, 65, 80, and so on and so forth. So what we did was we had them maintain 70 RPMs, and as soon as they dropped below 70, we cut it and testing was over. Now what we ultimately wanted to get from it was their last fully completed 60-second interval. We wanted that wattage, and we marked that as their maximum wattage. Okay, so a lot of them you'll see later that they got between 170. A couple of them got about 305 watts, and we used that maximum wattage to calculate what wattage they would be using in the subsequent intervals. Okay, so the real testing that you'll see for the graphs later is a total of 6 30-second high-intensity intervals. Now, based on that testing in the VO2 max, these 30-second intervals were done at 125% of their maximum wattage during that testing. There was also 90-second recovery periods in between these 30-second sprints, and that was at 20% of their maximum wattage, so that they could recover between these high-intensity exercises. And the data that we collected was VO2 using a metabolic cart, heart rate. We had a Garmin heart rate monitor that we used along with the Moxy monitors, and of course hemoglobin. And we also used the lactate plus analyzer to do finger pricks, and we did a finger prick before the VO2 max and after the VO2 max, and then we also did one after each of the 6 high-intensity intervals. And so that's the data and how we went about the testing. If we go to the next slide. So participant anthropometrics. So one of the parameters that we used for recruiting was we wanted everyone between 18 and 30 years of age. And again, we want endurance trained subjects for something like this, because we are looking long term at the military. And so we had 4 females, just 2 males. And as you can see, their body fat was within normal ranges. Some of them were lower down to 7, and some of them up to around 25. I do want to make note that a few of these athletes were very, very much athletes. One individual, one of the males, was actually a tennis player for the East Carolina team. And so he had a really, really good output, and you'll see his slide a little bit later. Also, we had an ECU hockey player who was on the club ECU hockey team. And then we also had another young lady who was a cyclist that was traveling the world. She was originally, I think, from Ireland, and I'm not sure if she was professional or not, but she would travel the world doing cycling. So these are some athletes. 2 of them had VO2 maxes above 50, so they very much were well trained. So these next 2 slides, I'm going to turn it back over to Dr. Wentz to talk a little bit more about our findings and what these graphs eventually look like.
And Justin did a great introduction for this. So we had 4 females and 2 males. And so we were aiming for people with a pretty strong VO2 max, so ideally over 40, but at least over 30 milliliters per kilogram per minute. And as Justin mentioned, we did have 2 people, 1 male and 1 female, who actually exceeded 50, which is a really high VO2 max. We had our male was a tennis player and the female was a cyclist. She was competing. She was a sprint cyclist in some world championships. And so this was, their actual VO2 max was pretty good, and even everybody else did okay. Everybody was well over 30, and half of our group was over 40. So we had a pretty wide variety of people who we recruited. And then what I want to be clear with this table, we will get to graphs, but this specific table is all of these measurements at the time of VO2 max. So if you're looking at SMO2, this is from their left leg and their right leg and their shoulder or deltoid. These aren't necessarily their maximum levels for this. We'll get to that in a future table. These are their levels at their VO2 max. So really what we're showing you here is, one, at least for some of them, and these are the 2 we're really going to focus on within this webinar, we're well trained. The second part is they did have a valid VO2 max test. Their heart rates were all high. So we did do a baseline blood lactate, and one athlete was high. He did not just come from tennis practice. He actually had to go to it after. So that is a little bit unexpected. But we did see everybody but 1 person exceeded 8 millimoles per liter, which is really what you're looking for to validate the VO2 max test. The change was really variable, but really we're looking for levels in this range to show that they really did have a valid test. And then within their SMO2, you can see here there's a shoulder, and we use that one as a control. So we tried to put one on the non-working muscle, and then we had one on their left leg and one on their right leg. And where we placed it was in the quad, and if following the ISAC protocol, it would be right on the mid-thigh. So what we did is the spot we used for skin folds, so we had it measured, we put the monitors in exactly that place. So we did measure it, so they were on the same place within this same place for each leg, and then also, the same place between subjects within their, general anatomical landmarks. So we did try to control that as best we could. So it was on the quad for each of these left and right leg. And these are really they don't follow any specific pattern between subjects, so this is even for the same subjects. And we do see a lot of this. The right leg was definitely more dominant. And then we did have some places where we lost the left leg monitor, and we'll talk about that a little bit. This is each of their maximum wattage, so you can see these 3 at the bottom who had the higher VO2 max definitely exceeded, they reached a much higher wattage, whereas these 3 people just weren't as well trained as some of the other 3. So we're really going to focus on the 2 of these, but I do want to talk a little bit more about the SMO2 specifically. So for each of these 6 subjects, one of the things that we tried to do was to make our own internal calibration with this. And so how we did that was we used a large blood cuff on their leg and tried to see what we could get the minimum SMO2 to within just a resting calibration. And I know this is done a lot in other NIRS research, but they typically use an electronic blood cuff where it goes very quickly, cuts off the circulation, get a minimum value, and release it for the subject. Ours was a little bit slower and painful. You almost had to keep cuffing until the subject's leg fell asleep. So the interesting part here is we have this within the calibration, and then we also have the minimum that they reach during their intervals, and this is during intervals and recovery. So we had the Moxy going the entire period through their intervals and through the recovery period. And we can compare it. So it's fairly interesting. So for example, this subject didn't quite reach that minimum during the high-intensity intervals, but did reach a high maximum. We did see a lot in the 90s. So they did get them up pretty high. But there are some differences here, whereas this subject was very similar, reaching the lowest level that we could get with the calibration. This one, we couldn't get the calibration that low, but during cycling, the subject was able to drop it all the way down. So this calibration didn't work quite as well as we'd intended, and truthfully, if you're trying to look at minimums, the minimum during their high intensity intervals is probably a better measurement for the lowest level they could get. You can see within the right leg they don't really drop that low even during these intervals, so much lower on the left, and the calibrations were for the most part a little bit lower, but then in some subjects we have some anomalies, and then some we just couldn't do it. This particular subject had larger legs, and we just couldn't get him down that low, and you can see even here within, he never really dropped that low ever, so he never had really low levels. But everybody did pretty much get their maximum at a fairly high level. And then, as we had mentioned, we're really just going to focus on two. So the thing with this monitor, as we were looking at how to analyze the data, because all of this is so individualized, you can't do a typical type data analysis, or at least we couldn't with this specific project, where we pull all of the data together and talk about means and standard deviations and do more standard statistics. So what we did instead was really just look at this on an individual level per subject, and look at the graphs and the patterns and see what was going on within a specific subject. So we isolated two, the cyclist and the tennis player. They were the two with the VO2s over 50, and they had the most interesting graphs and most interesting patterns, and really the type of subjects who we were aiming to recruit. So what these measurements show you is each of these measurements at the end, at the exact and 30-second end period of each interval. So each interval lasted 30 seconds. It was all out as hard as they could go. And then these measurements were taken at the end of that as they started their recovery period. So this is our control left monitor from the left shoulder. And you can see it's variable by individuals. And the other thing I do want to mention as we go through this is we did mark the monitors. So we have 3 monitors. The subjects always wore the same monitor on the right leg. The left leg was always used for the left leg, and the deltoid was always used for the deltoid. So we did mark those, and those were specific, so that if a specific monitor varied at all, we were able to control for that in that way. Within this one, we did lose the left monitor a couple times. One thing with these all-out cycling is they were really shaking on the bike. They were moving a lot. It was just a bike in a lab. And so they weren't able to bring their own cycles. They were allowed to bring their own pedals and shoes if they chose to, but the bike we used was standard, so that could have played into part as well. They were really shaking, so we did drop it a couple times within different readings. So the shoulder is pretty consistent. We don't expect that to change a lot. And at the end of each interval, you can see the left leg here is high, the right leg's much lower. Same kind of pattern here. The left leg's much higher and the right leg's much lower. But you can see within these blood lactate that they were really pushing it on these intervals. So all these blood lactates are high. And then some of those, we weren't able to get all the blood lactates either. Their hands were really sweaty or really tough or calloused, and we just weren't always able to get a reading. You can get the blood prick, but it takes about 15 seconds for the monitor to read it. So if it doesn't get a reading, it's too late to do another measurement. But even within his two, you can see that we were, he was getting pretty high blood lactates within there, and 16 by the last one. Then one thing we were able to get is heart rate and VO2, and this is the other thing with the intervals. They were hooked up to the metabolic cart the entire time through these intervals. So they were able to take a nice recovery after their VO2 max, but then we set them back up, and so throughout the entire period of these intervals, we kept them on the metabolic cart so we could get a picture of their VO2. And so if we compare that to their VO2 max, we can see, too, that these subjects are really pushing it. This one was really consistent, over 80% for each of the intervals. This one started a little slow, but then picks it up at the end, and you can see by the end that's 16% blood lactate. So this is really just a snapshot showing you that these subjects did do the intervals as we asked them to do. They had a high VO2. They pushed the intervals as hard as they could. So it makes them interesting people to look at through these intervals and through the recovery period. And so here's where we're just going to go with individual graphs. So what we have for you are 6 different figures within these, between these two subjects, comparing to, because we have a male and a female, and they do actually have quite a bit of different variation, whether it's due to their training or their gender, I can't say for sure. And just to plot all of these measurements over time, because that's really the best thing, the best approach we had for this specific data was to plot it. So what we have in this one is our total hemoglobin readings from the Moxy monitor, and our SMO2 from the left and right leg, and the deltoid or shoulder. So the first thing I want to point out is this one that's high the entire time. These dips within this left leg are what we want to see, but we did lose the monitor for different periods here within these straight lines, so that's not really reading as consistent as it appears to be. The other thing I want to point out, and this is going to be consistent across all of the graphs that we're going to look at, is the intervals. The first interval starts at 1:30. So they had a 90-second warm-up period, and then at exactly 1:30 the interval starts, and it ends at 2 minutes. So if you draw the line up right here, and I mean really if you just look at it visually, you can see 6 different intervals. But just to give you a time period, so it's 1:30 to 2 minutes, and then a 90-second rest period, and that was an active recovery, so they were going at 25% of their maximum wattage. So they were still hooked up to the cart, we were still taking full measurements, and so the Moxy was still going continuously because we were just as interested in the recovery period as we were in the actual interval itself. So they're hooked up going throughout this whole 13-minute period. So then the second interval starts at 3:30 right here, if we look at this 3:30 period, and then ends at 4. And so some of the readings are a little bit, I don't know if delayed is the right word, because probably the physiology is also delayed with it. You know, they're going out as hard as they can, and then we see a lot of these drops and spikes. So what we are looking for here, specifically, and we'll start with just the right and left leg of SMO2, so that's the gray and the red. Like I said, the red we did lose a little bit at different times. The gray follows a much nicer pattern, so it's really dropping at the end of each of these intervals. So you can see each of these intervals, because they're all ending at 4 minutes, at 6 minutes, at 8 minutes, at 10. And that's really what it should look like. You know, their muscle oxygen saturation should be depressed at that specific time point. And then we also did the control with the shoulder. And we do see some slight variation within the shoulder. And I think that really depended on how much the subject themselves moved throughout. So we see some of that variation within them. The hemoglobin itself, we saw small little spikes, but that was, as far as following the same pattern as the other, that had some slight variation, but that was pretty consistent across the measurement. And then this is surprisingly the same type of graph, just with the male subject, and it's interesting how different it looks just across 2 different subjects. So same measurements. And for this subject, the shoulder did have quite a bit of variation, but I do want to point out within these scales. So what we did to really magnify these changes is we did zoom in a little bit on these scales. So we're not starting at 0, this is at 50%. We really didn't have too many people who dropped below 50% during these intervals. So they stayed pretty high. I mean, we've had a few in the 30s, but even these really highly trained subjects, they got about, 50% was about the lowest they got within these intervals. So, looking at the shoulder, we did see some changes here. We saw here's the red is the left leg. So this one is still higher than the right, but better measurements than what we saw with the other person. And the 90 is the cyclist. So she might have had a dominant leg in a specific pattern with that too. That might have been a little bit different. That made her different from some of the other subjects that we had. And then we have the gray is the right leg. So following that, the intervals again ending at 2 minutes, and that's the largest dips. But there is a larger dips here with the hemoglobin as well, so we see a little bit more pattern, whereas the earlier one was pretty straightforward. We also plotted.
Laurel,
go ahead.
I'm going to break in here for just a second. We got one question here, and just a reminder to everybody: if you want to ask some questions, you can type them in the panel on the right side. But the question we have here is, what was the motivation for choosing cycling instead of running or hiking, since these were military recruits?
So that's a great question. So let me say a couple of things about that. There are a few different answers to that. One is these subjects themselves were not military recruits. This was a pilot study that we did, which is people we could recruit from ECU, to just look at the Moxy monitor, to look at to show the military clinical investigation team that this was a useful tool. So a lot of people do this within military research because it's very hard to get it cleared to go in and work with military subjects, that you have to show that what you're doing is specific only to military recruits and you can't study somebody else. So for our pilot study, we decided not to do that. So that's the first part, is these subjects were not. The second question is, we didn't do hiking because we wanted a laboratory study. So we wanted a study, especially the chief clinical investigator at WOMAC was very, he really wanted to see us use this in a controlled laboratory environment, which makes sense if we're just looking at it from a pilot perspective. In a laboratory, we can control absolutely everything. And the reason we chose cycling over running is, so we looked at that within the bike, and it's just the equipment was better, and we thought that, the Moxy has been used more in cycling than running, and we would, as far as putting it on the quad, it would be a better test within the VO2 max. And running just has, I think, a few more variables, where cycling we could control it a little bit better with the bike and the time of day, or not the time of day, sorry, the laboratory conditions. So because people individually, I think, are more variable with running on the treadmill, and a lot of people can't run when they might be in good shape, whereas they'd be able to cycle and not use their full body weight. And the other reason we chose cycling as well is cycling is actually really popular within Special Forces. There are a lot of cyclists, and so that's one of the reasons they were interested in this too, both from a cycling perspective and a field perspective. So we thought, given the Moxy history in cycling, that this would be a good tool for us in the control within the laboratory.
Okay, we got one more question here. By lose the monitor, do you mean that the monitor temporarily read 0?
That is correct. That's exactly what I mean. So what we do is we would lose, I guess I should say lose the signal. The monitor itself we did not lose it itself. It was in the lab. So at different times we'd get cut off from the signal. So rather that's from, one of the things it could have been is the shaking. If these are 30-second all out, so they might have, if the monitor came loose, we didn't have it taped on tight enough, and we lost the signal with the computer.
Okay. Okay. All right. Well, we got a few more questions coming in here, so we'll take those at the end. But I'll let you go ahead with the rest of the presentation.
Okay. So, well, we have a few more graphs for you, and these are really the more interesting ones that we were looking at with the VO2 and the heart rate. So this is really the meat right here, the next few slides of this entire project. So that was the setup. But this is the meat. So the question is, are these monitors correlating with really controlled laboratory tests? So you look at VO2, right, as one of the standards with the metabolic heart. So our gray line, shooting color is a little bit on you, but the time intervals are the same. The gray line is our VO2. So ideally, what we want to see within these intervals is that VO2 is peaking and the monitors are at their lowest point. Okay, so again, this is the subject where we did lose the signal a couple times with the left leg monitor. But where we have the signal, it does follow the pattern we want to see. And I think these slides are really interesting when they're plotted, is it's at the end of each interval, so it's really the start of the recovery period. So you can see VO2 is at its absolute peak, and a few seconds later, the SMO2 is dropping at its lowest point. And so that first interval was kind of a warm-up. This is our cyclist. But as we get through more intervals, she really picks it up more. And so she's really getting, a lot better with her SMO2, pushing at the intervals. It's dropping at the exact endpoint of the interval and right around when the VO2 is peaking. And what that's indicating to us is, what we want to see, that the SMO2 within the legs is at its lowest point when the VO2 is at its highest. And then if you remember, this is also when we took lactic acid, which we didn't plot because we only have it for specific time points. So because it's not a continuous measurement, we can just get it from we're getting it from blood pricks, from finger pricks. But if we do take the lactic acid here, it's elevated, so that would make sense that their oxygen output is highest, their SMO2 is lowest, and their lactic acid is high. So that's really validating these measurements that we're trying to use. And then you can see within this interval too, this is 6 minutes at the third interval, and then this interval here at 8 minutes looks fantastic. So here's the VO2 peaking, both monitors are working together right here and dropping, and then we didn't have a real strong signal throughout the rest. And then within the second subject, this is the male subject, he just didn't use his left leg as much. He wasn't a cyclist, but he was a really good athlete. So I think he pushed the one leg a little bit more than the other. And the other thing you see with him that's a little bit interesting to him is his VO2 actually peaked a little bit after SMO2 peaked, and it peaked a little bit later, more into the recovery period, not during the interval itself. So that was fairly interesting, though for some of these it does pick up more. This was also, if you look at, when we broke it down by percent of VO2, his first interval was his weakest, which was the case for most of them, and they got stronger throughout. But he was pretty consistent here. And again, we're looking for these, these troughs, these nadirs at the exact point of the VO2 peaking, or not literally, excuse me, not necessarily exact point, very similarly. And his had a little bit delayed with VO2 response. But that would be what you'd want to see with the Moxy monitor, because most people probably don't want to wear a face mask all the time to do these intervals. I can tell you that because Justin and myself and a bunch of other people in the lab were piloting this protocol. And so every single person who worked on this project had to do some variation of this protocol. So we all know exactly what it's like to do these intervals with the mask on. When we were setting it up to make sure it was a reasonable protocol and reasonable for not necessarily elite, not necessarily regular cyclists. But then his a really nice consistent pattern across, pretty consistent with these drops in his SMO2 and his VO2 being high. And I mean, with the left leg monitor we got readings the entire time. It just didn't drop as low, which maybe indicates he was right leg dominant. And so the final graph that we have plotted is heart rate. And what we looked at here was SMO2 in comparison to heart rate, because that is one of the things when we were trying to bring this into a military population, and they asked what was the advantage over heart rate. And I think with them, especially a population that's so overtrained, and you can say that for a lot of endurance athletes, I think the advantage of using something like a Moxy is I think it's a better indication of their workload, because Justin was looking at some of the subjects, and one of the things he mentioned to me was not one of the ones that we presented, but a different subject was dogging it. You could tell from the monitor readings that subject wasn't going as all out on the intervals as she probably could have, based on her readings in comparison to the VO2. So that, I think, is an advantage of it, is it can give you a little bit more sensitive to the training rather than necessarily heart rate, where it can be elevated due to heat or other factors over training. So this is looking at heart rate. And heart rate itself, here's the other thing you see with the heart rate. Now you can magnify the scale a little bit, but we don't really see such a strong, we see these peaks here. And again, we lost the monitor reading a couple times. So we see this, but it's not as pronounced as either the VO2 or the Moxy reading. So we see a nice even change. And I mean, heart rate is a good tool to measure workload, but we think you can probably get a little bit more out of it with a little bit higher technology. And so it is, we are seeing what we want to see here, though, heart rate peaking when SMO2 is dropping. And again, we've seen this consistently within this fourth interval that the left leg monitor is picking up. So we see it, it's just not the pronounced pattern from the VO2. And then same for the tennis player, the repeat again, getting a little bit redundant, but I wanted to be clear, show you our best two subjects. Each of these are our best trained subjects, looking at how these patterns are. And here we can see the left leg, we've seen this in every graph so far, and his heart rate. But I think with the heart rate, you just get these little bumps in the heart rate, and it's helpful and it's a good measurement, but I don't think it's as sensitive to workload as some of the other measurements. And that really brings us to our overall conclusion. So it's not true to say that we actually validated the Moxy because we didn't compare it to other more established NIRS technologies, but that really wasn't what we were looking to do. We were looking more as how it works as a training tool. And as a training tool in a controlled laboratory setting where we had continuous measurements of oxygen output, with the metabolic cart, we continuous heart rate, and we took blood lactate, which was pretty, it gave it a much better level of looking at criticism and what we could do with it and making sure we got a true VO2 max test. So the blood lactate we feel is a really strong measurement to include in this. And from these data we see that the muscle oxygen saturation is lowest when workload is highest. And that seems like a really obvious thing to say, but before we did this pilot study we had nothing to show that that was the case necessarily. So looking at this, we could say now if we brought this into a field measurement that we have this correlating with other standard laboratory measurements. So like I had said a couple times, this was a pilot study. So what we were just trying to determine was this is matching other laboratory measurements. And somebody asked why we wouldn't do this in hiking or other field tests with the military. Well, that would be nice to do. That would be a nice future study, but our first study was to show everyone that this is measuring what we think it's measuring and the right patterns. So now, can we test it in the field and you know, with the way that military train and they're away from their human performance teams a lot, or they're hiking or in their field or doing different rucking, is this something that they could use? And, you know, kind of to Justin's point, is this something you could turn back in the feedback and see that somebody was dogging it a little bit and maybe not pushing that workout as hard as he was supposed to, or different goals. So we had fun. We had a lot of fun with this study, and we're hoping to expand it and do a little bit more, but this was just a short-term, you know, just an high-intensity interval within the lab to look at how this responds to these established measurements. So Roger, I'm happy to take other questions if people have them now, or explain some further information from the results.
Can I make a comment real quick? Can you hear me?
Oh, yeah, sorry.
All right, sorry. I just want to make a quick comment in regards to why exactly we chose the bike versus like a treadmill or something like that. So we did meet with the ECU exercise physiologist. And with this pilot study, I mean, we just want to create some good data that shows what Moxy can do. And we decided to put the monitors on the quadriceps, right? So after meeting with the exercise physiologist, the best way to really drive down oxygen saturation in the quadriceps is the bike versus a treadmill. When you're kind of using some other body parts, you know, and moving your arms and things like that. So truthfully, that is why we chose the cycle ergometer, simply because when you're pinpointing the quadriceps muscle and you want to drive that down within 30-second intervals, we felt like the cycle ergometer would give us the best data.
Okay.
Yes, great point. Thank you for that.
Yeah, thanks, Justin. Yeah. Okay, we've got some questions here. The first one, how do you believe these results are relevant while there are only 6 subjects and they are far from cycling?
Can you repeat the last part? There's 6 subjects and they're...
It says they are far from cycling. I think it means that they may not be cyclists.
Well, one of them was a cyclist.
Okay.
So this was just a pilot study. I mean, to be fair, we do have to expand this. This is just a small study within these 6 subjects. But even if we look at the ones that weren't cyclists, we still see the same patterns. So we presented the highest trained people, one of whom was a cyclist. We have the other 4 subjects that they have very similar graphs to the ones that we have here across different levels. I mean, I guess we could say that maybe is a strength, that we do have different levels of VO2 ranging from about 35 to 52. So we have it across different people. But this does need to be expanded. They're relevant because it shows that it's measuring what we think it is, and that this needs to be continued, and we need to do further follow-up studying before we make any conclusions.
Okay. We have a comment here. It says, maybe an option to make this difference in timing change between VO2 peaks and SMO2 drops is to actually plot the difference in seconds between VO2 peak and SMO2 lowest point for each interval.
Oh, that's a great point. Yeah, so we have to go back and look at the data. The metabolic cart, one of the things we have it on is it's a continuous measurement, but it doesn't necessarily collect data at every single second, quite like the Moxy, because I think we have the Moxy set on every 2 seconds. So we could look at that and zoom in a little bit more and look at some of those points at a finer tune. That's a great comment.
Okay. Another question here. Do you think the majority of variation between right and left shows issues with the Moxy measures or control overall, or another reasoning for possible dominance in right to left?
I don't know the answer to that, because all of them are left where I don't know the answer. So we always use the monitor on the left leg and the other one on the right, and that's actually, I would like to test that. I can't say for certain because our left leg was typically higher than the right, and we only had 6 people, so we did have a small sample size, so either they were all right leg dominant, or maybe there was something going on with our left leg monitor. But I will say this, we bought 1 monitor earlier, and then we bought 2 later, and the first one we bought was on the shoulder, and the second 2 were on the leg. So the 2 that we bought were purchased at the same time from the same, I guess, lot, for lack of a better word. But I mean, okay, that would be worth looking at our monitor and making sure that there's nothing going on with that specific monitor. Okay, I think Justin has a comment to that question as well.
Yeah, so as far as differences between the monitors reading and stuff like that, we obviously, like Dr. Wentz said, we can't speak for sure, but I will say that there was a subject that had significantly less SMO2 in the left leg during the entire testing protocol. And at the very end, I did happen to ask her, if she had a drive leg when she was cycling, and she did, and it was the exact leg that was lower in oxygen saturation. So, obviously not conclusive, doesn't necessarily mean there's a correlation there, but I think just speaking, physiologically, I'm just, openly thinking about it, it would make sense. And in something like cycling, there is, a lot of times, especially, like we talked about, if somebody isn't a trained cyclist, when they get on there pedaling as hard as they can and they get fatigued, especially in that 4th, 5th, 6th interval, towards the end, you do kind of tend to use a dominant leg. So I think there might actually be something there as far as people, whenever they're cycling and maybe even when they're running, they do have a drive leg, which is a very common thing with athletes. So I just wanted to make that comment about, there was a little, comment by one of the subjects that it was indeed her drive leg. So.
Okay. The next question is kind of along the same lines. If the SMO2 response during training is so much different from person to person, from person to another person, and from side to side, right to left, how can it be used to assess the training load?
So that is a great question. And, when I did the training with the Moxy with Marianne, one of the things they really emphasize, and you guys can correct me on this as well, is that the way the monitor works is you really do have to use it on an individual from person to person and make, so look at that person's patterns. But if you have one person using it consistently, you would have a lot of their data that you could look at. And so that's one of the reasons that we showed you that individual data with each individual person's minimum and maximum. So we have, I think what you need to do then is establish a min and a max for each person and then look at the training load within that individual's min and max.
Okay, great. Well, we are at the end of our time here, and there are still a lot of questions on the board and some more still coming in. So I think what we can do, we will post a recording of the webinar in our forum, in the discussion forum, and then I will post these remaining questions on there, and then if Laurel and Justin wouldn't mind taking a look at these additional questions, we'll just answer them on the forum, if that's okay with you.
Yeah, that sounds great.
All right. Thank you so much for putting on the webinar and sharing this data. We really appreciate it.
Thank you guys, and thank you everybody for attending. We really appreciate it.
All right. Bye-bye, everybody.